How do I know if my yeast infection is resistant to fluconazole?
Hello, and welcome to our discussion on a topic that might be slightly uncomfortable but is quite important: yeast infections. More specifically, we'll be talking about how to identify if your yeast infection is resistant to fluconazole. Fluconazole is a commonly used antifungal medication, and knowing when it's not working is crucial to your health and recovery.
What is a yeast infection?
A yeast infection, also known as candidiasis, is an infection caused by a group of fungi or yeast, most often Candida albicans. These infections can occur in various parts of your body, including your mouth, skin, and genitals. Women are especially susceptible to vaginal yeast infections.
What is fluconazole and how does it work?
Fluconazole is an antifungal medication used to treat and prevent a variety of fungal infections, including yeast infections. It works by stopping the growth of certain types of fungus.
Signs your yeast infection might be resistant to fluconazole.
If you're using fluconazole to treat your yeast infection and you're not noticing any significant improvement, it's possible that your infection might be resistant to the drug. Here are some signs to watch out for. 1. Persistent symptoms. If your symptoms persist even after you've completed the course of fluconazole prescribed by your doctor, this might suggest resistance. 2. Recurring infections. If you're having frequent yeast infections despite regular fluconazole treatment, this could also be a sign of resistance. 3. Symptoms worsen or return shortly after treatment. If your symptoms initially improve but then return shortly after finishing the course of fluconazole, this could be another indication of resistance.
What to do if your yeast infection is resistant?
Do not self-diagnose or self-treat a resistant yeast infection. If you suspect your yeast infection is resistant to fluconazole, it's essential to consult a healthcare provider. They may conduct tests to confirm resistance and prescribe alternative antifungal medication or a combination therapy to effectively tackle the infection. Yeast infections can be troublesome, and when they don't respond to typical treatments, they can be particularly distressing. However, remember that resistant infections are manageable with the right diagnosis and treatment. Always consult with a healthcare provider if you suspect resistance. Stay informed, stay aware, and stay healthy. We hope this guide has been helpful in understanding and identifying resistant yeast infections.